Older people who take a group of drugs used to treat conditions including asthma, depression and epilepsy may have an increased risk of dementia or even death. That's according to new research out today. Doctors are being warned about the possible risks of prescribing some of the more potent drugs together.
Anticholinergic drugs are used for a wide range of conditions. They block the ability to pass on messages between nerve cells. In this study of people over 65, nearly half were taking some form of this medication. The researchers ranked more than 80 of the drugs into categories of mild, moderate and severe to work out a score for patients. They found that those on the most potent doses, involving 2 or more drugs, had an increased risk of mental decline and death. They looked at more than 13,000 people and found that 20% of patients with the highest score died during the 2-year study, compared with 7% of those who were not taking this medication. They advised GPs to consider their findings. Doctors say they already monitor medication closely and that patients should not be alarmed.
I think the first thing is not to worry too much. The second thing is to discuss it with your doctor or the pharmacist. And the third thing is do not stop your medicines without taking advice first.
The data used in this study goes back 2 decades. Doctors say there's now a much better understanding of the risks. Adam Brimelow, BBC News.
Well, let's talk to Ian Maidment now, who's a clinical pharmacist who is involved in this study and joins us live. Thanks very much for being with us.
Thank you.
Just explain to us in a little bit more detail, if you could, what kind of drugs we're talking about here, what kind of medicines?
It's really a very wide range of medicines. It's heart drugs, antihistamines, drugs for bladder problems, antidepressants, antipsychotics. Lots of drugs have this effect, so it's a very, very wide range of medicines.
And just explain exactly, you talk about this effect, what exactly do you mean by that?
Basically, what the drugs do is they work against a neurotransmitter called acetylcholine, and they make that work less well. And that's a very important neurotransmitter in the brain and also in the body, and that causes the side effects.
And the side effects are, just give us an idea of what we're talking about here.
I mean, the side effects is very wide-ranging. Confusion, they can worsen cognition, so it can kind of cause like a form of dementia, a mild dementia. They can cause incontinence, they can affect the heart rate, they can cause blurred vision, constipation, very wide-ranging, both centrally and in the rest of the body.
All sounds quite alarming. I suppose the problem is people watching this will be worried about, what they're taking, in what combination. Should they stop immediately? Should they go to see their doctor? What should they do?
I think this is a key message I want to get across. Reiterate the point by your GP from the Royal College that patients, we should reassure patients. The key thing is they should continue taking their medication as usual. If they have any concerns, they should discuss them with their GP or their pharmacist at the next review. But the key message is carry on as normal and discuss it with your clinician at your next medication review.
I mean, is this study, the results that you have so far, is it definitive or is this just a kind of preliminary finding?
I think it does need replication in another study, okay? I think the effect on cognition and dementia, I think that's pretty definitive because you'd expect that from the way the drugs work, okay? I think the effect on mobility, that does require replication elsewhere. But certainly the effect on dementia and cognition, I think that's pretty well understood, to be honest.
All right, Ian Maidment, thank you very much indeed.
Thank you.
Combinations of common drugs could lead to brain problems or even early death, according to a new report. People aged over 65 using tablets for heart conditions, allergies and depression are among those most at risk of complications. As our health correspondent Tom Savides reports, the University of Kent has been spearheading the research.
Yep. Okay. At 84 years old, George Marsden from Whitstable is on a variety of different drugs. He's aware that combining certain tablets may cause problems, so he double-checks before taking them.
I've lived this long by being careful I take. I've been regulating it myself for years and years and years.
As we get older, we rely more and more on drugs, but multiple courses could seriously damage our health, according to a new report. A variety of common drugs, including antihistamines, painkillers and blood-thinning medication, may lead to declining brain function and even early death.
We think it's a combination of several of these medications, which is something else that we showed, not just one. It was the several together, adding it up together gives you the big impact.
The study looked at 80 different drugs. Some, like Piriton, are available over the counter, whereas others, like paroxetine, an antidepressant, are on prescription only. The research found that taking 2 or more of these drugs could lead to serious problems in those over the age of 65. Ian Maidment, a pharmacist based at the University of Kent, is one of the researchers who examined the possible side effects.
All medication causes risks, all medication has benefits, and patients need to make informed choices. Adding all the drugs together, that can be the damaging effect.
The scientists also suggest that a combination of some treatments taken by elderly patients with dementia could make the condition worse.
They may have that little bit more confusion, losing where they are, not understanding the context of things.
Those taking a combination of drugs are urged not to panic. They should seek advice from their doctor about the medication they're taking. Tom Savidas in Whitstable for Meridian Tonight.